Hello, in this video, me and my group members will be going through an immunodeficiency disease called X-linked severe combined immunodeficiency, XSCID. We'll be going through the signs and symptoms, causes, diagnostic methods, and treatments available for this disease. Have you ever heard about the bubble boy disease? Or have you watched the movie Bubble Boy? Babies who are born with mutations in some immune system genes lack the correct genes which lead to them not being able to develop a normal and healthy immune system. Because of their weakened immune system, they cannot fight off foreign invaders and even minor infections can be deadly to them. This disease is called SCID. At one point in the past, the only way to manage this disease was to isolate the sick child in a sterile environment, hence the name Bubble Boy disease. The signs and symptoms of this disease become apparent in early infancy and may vary from patient to patient. These symptoms include rashes, diarrhea, recurrent infections, difficulty gaining weight, weakness, growth delay, etc. Let's look into the causes and mechanisms of this disease.
X-linked SCID is an inherited X-linked recessive disorder. It causes the mutation in the ILR2G or interleukin-2 receptor subunit gamma gene that is found in the X chromosome. Transmission usually occurs via a mother that carries a mutation in the ILR2G gene in one of her X chromosome. Males are more prone to X-linked SCID as males only have one X chromosome whereas females have two X chromosomes and most probably will turn into a carrier. Males with X-linked SCID will pass the pathogenic variant to all their daughters and none to their sons. Usually, infants that are affected with the X-linked SCID will die in 1 to 2 years of being born. The ILR2G gene provides instruction for making a protein called the common gamma chain. This protein is a component of several different receptors that are involved in the immune system. One of the main functions of this receptor is to generate a protein that is needed for the maturation of lymphocytes. The lymphocytes are one of the main components of the immune system. It can be divided into two, which are called B and T lymphocyte. The B lymphocyte produces various antibodies that will attach to a foreign substance, while the T lymphocyte will recognize the attached antibodies and destroy any foreign substance that attaches to it. Mutation in the ILR2G gene will result in near complete absence of the T and natural killer lymphocyte and non-functional B lymphocyte. Thus, the body can defend itself against pathogens.
Diagnosis of XSCID. Due to repetitive infection and failure to develop, normally the children are diagnosed for XSCID at the age of 6 months old. Blood tests are done to diagnose the disease, and if results show T cells and natural killer cells are absent or significantly low in number and B cells are present in normal level, the child is diagnosed with XSCID. One characteristic of XSCID is when there are low antibody levels and lack of specific antibody after an infection or vaccination. If mother is pregnant and the family has known mutation leading to XSCID, the baby will be tested for the disease by sequencing DNA from the fetus. Since this test is very expensive, it is not recommended if there is no family history of XSCID. An early diagnosis of this disease is very important as the best chance of treatment working is during the first few months of an infant's life.
X-SCID patients are unable to make T lymphocytes and the B lymphocytes fail to make essential antibodies for fighting infections. Without these lymphocytes, patients develop fatal infections. As of today, bone marrow transplantation, also known as BMT, has been the most effective treatment, and gene therapy provides clinical benefit to X-SCID patients. As for BMT, the treatment involves removing the patient's bone marrow, filtering and purifying the child's blood stem cell, and incubating them with the lentiviral vector to insert a healthy copy of the IL2RG gene. The re-engineered cell line is then transfused back to reconstitute T cells, natural killer cells, and B cells, creating a broad immune system function. As for gene therapy, the patients who had their own blood-forming stem cells are harvested and frozen in a blood bank. These cells contain defective genes and a correct copy of the gene will be inserted into the patient's body. Firstly, the cells will be unfrozen and kept for 4 days in growth factors. Particles of a retrovirus will be constructed and tested. Then, this retrovirus particle is then attached to the patient's cell and introduces an accurate copy of the common gamma chain gene into cell capable of growing into all types of blood cells including T and B lymphocytes. Following, patients will receive a single dose of their own cell that has been modified and also will be given a drug called perlifermin to help prevent side effects from the chemotherapy and possibly try to improve the development of the T cells. At the end, the patients will be monitored to find out if the treatment is safe and to see if their immune function improves.
In conclusion, X-linked severe combined immunodeficiency is an inherited X-linked recessive disorder, which is caused by the mutation in the ILR2G gene that is found in the X chromosome. Transmission could occur via mother to an infant that carries a mutation of the ILR2G gene in one of her X chromosomes. Males are primarily the ones affected and females are mostly carriers. Signs and symptoms vary between patients. They may include rashes, diarrhea, recurrent infection, difficulty gaining weight, weakness, growth delay, and those symptoms can be identified in early infancy. Usually, 6-month-old children can be diagnosed with SCID by doing blood tests and check to see if T cells and natural killer cells are absent or low level and normal level of B cells are present in the blood. If there is a family history for leading this disease, the baby can be tested by sequencing DNA from the fetus, and early diagnostics give chance to start treatment in the first few months of the infant. Bone marrow transplantation is the most effective treatment for SCID, which involves removing the patient's bone marrow, filtering and purifying the child's blood to create a broad immune system function. Being aware of the causes of this disease, symptoms and family history provide a high chance to prevent and treat the disease. If not treated soon, the prognosis of the disease is poor and the child may die 2 years after they are born. Since X-linked severe combined immunodeficiency is a fairly less known disorder, we hope that this video has given you some insight into it. Thank you so much for watching and feel free to share and comment.